Um, when it comes to working with trauma, our guest today feels like we're missing a very important dimension, and that's the dimension of moral distress and moral injury. So, in the next 15 minutes, you're going to learn a lot about moral injury, how to work with it as a therapist, what it is, and how it differs, maybe most importantly, how it differs from trauma and PTSD. So, I am here with Jack Saul, one of the world's foremost experts in moral injury and moral distress and collective trauma. And my name is Zach Taylor. I'm the director of Psychotherapy Networker, one of the largest magazines that's read by therapists around the world. So thank you for joining us. And Jack, thanks for being here.
Thank you for inviting me.
Jack, I want to jump right in because this word moral injury, we've all heard it as therapists. We want to know more about it. But talk to us a little bit just about what moral injury is and how it's actually different from PTSD, although they're often intertwined.
Yes. Well, moral injury really refers to someone being in a situation where they act or they witness something that they find morally reprehensible. And it causes a tremendous amount of distress. And we often see this among military veterans. And they will come home from war and be distressed about situations in which they've had to kill. Even if it was an act of self-defense, they will still feel this kind of distress from having taken a human life. But then there are a lot of situations in which they find themselves in atrocity-producing situations, which will cause distress and tremendous amount of shame and guilt as well. So the dangers of moral distress, moral injury, is that when someone feels like they can't really speak about these experiences because they're ashamed of it, they tend to isolate and withdraw from significant others, their community, and then go into a kind of that really they sink into a kind of darkness that can lead to substance abuse and suicidality and severe depression. And people now, I think, who are working with veterans, they really are saying that this is the most significant cause of suicide among veterans. And it's been noticed since the beginning of the term, since the first time the term was coined by Jonathan Shea, the naval psychiatrist working with Vietnam veterans. He really said then that this was the most serious cause leading to suicide.
I think that's so interesting because for all we know about trauma and all the focus that's been on trauma, I don't actually hear moral injury brought up in a whole lot of trauma treatment training. So it's pretty fascinating that you believe, and many other researchers believe, that what's driving suicide among veterans, among healthcare workers, it's not the traditional PTSD symptoms, the flashbacks, the nightmares, the bursts of anger potentially, but it's this moral distress that these people feel inside from having witnessed or done something that was against their sort of moral code as a human. Can you unpack that a little bit more?
So
And
I want to tell you how I kind of started to be interested in this.
yes,
I
please.
was working in therapy for the past 20 years with war correspondents, reporters and photographers covering the wars in Afghanistan and Iraq and other countries like Syria. And they were, in the context of covering a war that was in itself morally questionable, because the purpose of it they were seeing it was not what it was stated to do. It was, we entered a war under false premise, and the stated reasons were not really correct. So there was a lack of purpose and a feeling that the wars were illegal according to international law. So that in itself was problematic. But what they were witnessing, these journalists, were often these atrocities and ways in which civilians were being caught in the warfare, and they were witnessing many casualties. And the practices of the military seemed to be questionable when it came to the ethical and legal nature of what they were seeing. So that, first of all, they were feeling some distress about witnessing. But then they were often in situations where they found that it was difficult to actually cover the wars in a way that they thought needed to be covered, because um, the news agencies had shifting priorities about what was acceptable to speak about. I think first there was a tendency to want to portray those wars as not too negative and not so destructive, and there must be something good. But they weren't seeing a lot that was good coming out of those wars. Yet I think many of them felt constrained in being able to tell the story. So there were a number of things like that. What I did see is that they might be suffering from PTSD, but many of them were also dealing with this moral distress, and it needed to be addressed in a very different way. And it was often it had to do with how they viewed, or the feeling of betrayal, often by their organization or others who they were working with. And so they needed a way of addressing that. And so I started looking at the literature, and the literature really, over the years, has been focused on soldiers and veterans who were fighting wars and who were much more severely affected by moral injury because they were killing and perpetrating violence.
But you're saying it also happens among healthcare workers, first responders, anybody in a situation where they're forced to choose sort of between protecting themselves and protecting maybe another, or has to somehow cross their moral code. Can you give an example of how?
We saw that during the pandemic. There were many healthcare professionals who were caught in situations where they had to make a choice between who was going to get the ventilator and who was not.
Right.
So they were making life and death decisions about people, often because they didn't have the resources available to help people. Or these days, I mean, even I've had responses to my article in the Psychotherapy Networker from healthcare professionals, surgeons. People are saying that they can't do the best work that they can do in providing the kind of healthcare that people need because of the constraints of the healthcare institution.
Right.
More and more, we're seeing the conflict between the profitability of healthcare versus, what needs to be done in order to provide people with the best healthcare that they can get. And it's putting people in situations, or healthcare professionals in situations, where they're not able to do what they signed up to do, which is provide good healthcare. That causes a tremendous amount of moral distress.
Yeah. I want to just pause there. And you mentioned your article in Psychotherapy Networker magazine. If you're a therapist, this is a great publication to just be reading and checking out every once in a while. Jack wrote probably one of the most moving and educational pieces I've seen in the Networker in a long time. And so I really encourage you to, Cole put a link down below, encourage you to read Jack's article. If you want to understand more about moral injury as a therapist, if you work with trauma and you don't fully grasp how to work with moral injury, this is the article to start with. And then go get some more training. Also, if you'd like to become a subscriber to Networker Magazine, it's just $12 a year. It's $1 a month. And we'd love to send it to you as well. We've got a special offer there in your chat and at the bottom of the screen. Yeah. Also, if you have a question for Jack, just please put it wherever you're watching this. If you're watching live, we'll have a little time for some questions at the end. Now, Jack, could you, so much of our focus on trauma, I'm just fascinated by this because when someone comes in with traumatic stress, I'll admit, as a therapist, I almost never looked for the moral dimension of what they were dealing with. And I focused mostly on the memory because I did EMDR. And so I would look for distressing memories and we would work simply with that memory. And we would work with cognitions. I don't want to misrepresent EMDR and some of those thoughts that they have about themselves, but I never thought about it through the lens of moral injury. Talk about how moral injury is actually different from traumatic stress and how they can both coexist and exist separately.
So the traumatic stress is usually thought of as a fear-based problem. Someone has been in an overwhelmingly stressful situation, one in which they've been threatened with death or serious injury. And so they will have a response afterward where they're fearful by situations that remind them of that original situation. So that's the dominant narrative about trauma. I don't buy that one myself. And I'm actually very critical of that perspective because many of the people that I've worked with who are dealing with trauma don't have PTSD. I think most people who are traumatized or are dealing with these overwhelmingly stressful situations are dealing with many other kinds of things like somatization or relational issues. I think, and as a family therapist, I have just focused on quite a bit on how trauma is not necessarily located primarily within the individual, but is located in the relationships between individuals. And
I want to focus on that because we've got, as a field, we've got to get a handle on this word trauma and PTSD because it's sort of just, we kind of throw it around so much. And I'm so glad to hear your perspective. But then we've also got this other issue where trauma is, we've found it within the individual. And a lot of your work, especially your great book on collective trauma, opens it up to show that the seat of moral injury doesn't just reside in the individual, but is it within the societal and familial context in which they live. Talk more about
so
how it's
one of the
beyond the
things I've
individual.
noticed in my work with all kinds of trauma survivors is that many of them, and I saw this a great deal among journalists who were covering very serious traumatic events, disasters, killings and war, that they could handle these kind of highly stressful situations quite well if they had a supportive social environment around them.
Yep.
And even some of the research, like on the tsunami coverage by some journalists, found that the relationship with the manager and their organization was actually more predictive of whether they were going to have PTSD or other kinds of traumatic or mental health issues later on than the severity and duration of the traumatic event.
Yeah.
So, and I have seen that over time that people deal pretty well with these kind of events, but if they feel like they're not supported or people
Mhm.
don't acknowledge what they've been through, or there's a whole different narrative about the situation that leaves out their reality
Yeah.
or silences them,
Yeah.
then it becomes problematic
Yeah.
for the journalist if they start to feel like their job is threatened because they're just not, understood. They're having a reaction, but I think people naturally can deal with some of these reactions, but they need to be feeling safe and supported by the people around them, or then they start to feel much more anxious.
Well, this is where I want to mention your incredible art installation. Jack's done an incredible job of helping people with moral injuries share their stories at moralinjuriesofwar.org. We're going to put that link up there if you want to go to it. But moralinjuriesofwar.org. It's both a live art installation, and there's pieces of it on Jack's website here. But you've found that allowing that silence is really a perpetrator of moral injury, not being able to talk about it with people who understand what they did and why they did it. Talk a little bit about what you're trying to do at moralinjuriesofwar.org.
So in this project, we recorded journalists and veterans speaking about their experiences of moral injury, their moral difficulties, and they spoke about what they experienced, what helped them deal with it, what they would like the public to know about these experiences, what they would like the public to know about our war making that they don't know about. There's such a split between military and civilian these days, or people who have witnessed war and just the general public, that people don't understand. They have a hard time conveying their experience. People either don't understand, or they're afraid to ask, or people are not interested. So we live in a society that knows very little about the realities of war, and that is felt very alienating to the veteran, especially, and journalists too.
Right.
So to have a site where they can engage in conversation with the public and be able to talk about their experiences. In our case, we're playing this audio installation that has some of these difficult stories already have been recorded. So we can minimize the amount of re-traumatization of having someone get up and telling one of these difficult stories.
Right.
So it's played, and then we can have veterans there to talk more with the public about what they want the public to know about this.
Yeah.
And that interchange is found to be really healing for the veteran. It's difficult, but they really appreciate the public listening to them and taking an interest and acknowledging what they've been through. And we also kind of create the context for the public, not only to acknowledge, but to recognize how we are implicated as a public, as citizens, in the wars that we send our soldiers to fight. And so that sharing of responsibility is also important. A colleague of mine who does this work at the Philadelphia VA, Chaplain Chris Antal, defines moral injury as the unequal distribution of appropriate moral pain. Others in society are not dealing with this pain of war. So the veteran who has experienced this becomes kind of the identified patient for society in experiencing this pain, while others do not. I think I would go even further by saying that it's an unequal distribution of appropriate moral accountability. These veterans are taking on the responsibility and the burden of guilt and shame about these experiences, partly because the people who should be held accountable are not being held accountable. The decision makers, the officers who send people out to do morally questionable actions, there's very little accountability, I think, in the military. And so they're left to be the ones wondering, why did I end up doing this? Why was I sent out to a massacre and told not to act and just let it happen? These kind of things people, carry for years. And it's very common in their narrative that they turn to drinking or drugs, and they just they don't ever speak about it in therapy because they don't feel like this has to do with healing. It
Right.
has to do with something that they did wrong, and they're responsible for it.
Yeah.
And
It's
so,
so important that we as therapists pick up on that when we have trauma survivors come in, that we look at this moral dimension. And your important point, it's not just an individual thing, that the healing truly is collective in being able to share their stories widely and understand that they may have done these things in a context where they were sent. They were put in a situation they didn't ask necessarily to be in. So I love your perspective. And I think it's, who was it? Pia in the chat said, it makes me think of the difficulties mental health professionals are put in sometimes when we work with clients, and sometimes we can't help in the ways that we want to because our role is to be psychotherapists. Can you talk at all about sort of maybe mental health professionals and the sort of the limitations on their work, maybe causing moral injury?
I see a question here from Pia Granjon
Yeah, that's who I'm
about,
referencing.
about working in refugee camps.
Yeah,
So, I think that humanitarian workers, mental health professionals, journalists covering the refugee issue often feel a tremendous amount of moral distress in doing
yeah,
that work. And I actually come from the field of working with torture survivors and survivors of refugee trauma.
yeah,
Um, Many years ago, I was doing this kind of work here in New York. And one of the things that we began to do, I think partly as a way of addressing some of the feelings that couldn't be dealt with in the context of the privacy of the therapy office, was to go out, and we created at our clinic, well, it, we created a theater group so that refugees could come and tell their story and work with the theater group to create scenes and plays that could then be played to the public. Now, these were not patients. They were just other refugees that wanted to engage in a collaborative art project. They were very motivated to do that. They weren't motivated to go to therapy because often survivors of political violence feel that therapy is too self-indulgent. They don't deserve it. And they need to, and plus they have an obligation to do something about the people they left behind. So they need a context in which they can engage in some kind of moral repair. And I think this is the moral dimension also for refugees
yeah,
who also suffer from moral injury. And so they, having a place where they can be acknowledged, well, in this case, by the theater group, work collaboratively with them. And I've always been an advocate of the arts as a way of helping
yeah,
people recover a sense of agency,
yeah,
of moral and political agency after being, in such a situation which radically disempowers people.
yeah,
So through the artistic process, they can begin to find ways of expressing their feelings, but also telling their story in a way that has a purpose, not telling the story just for therapy, because
yeah.
that doesn't make a lot of sense for a lot of political
Exactly.
survivors. So creating art, creating plays that can convey their experience to a public with the hope ultimately of being able to prevent the kind of atrocities and injuries that they've experienced and the people around them have experienced. That becomes a meaningful, purposeful way of turning the experience into something of value.
Mhm.
And that, I think, is what is really needed to address this kind of moral injury.
Yeah,
It's a reparative process. It's not just a therapeutic process.
that's a
And
good point. It's a reparative process, not just a therapeutic process. We have time for just a quick question here, but again, Jack wrote an incredible article on moral injury in the latest issue of the Psychotherapy Network magazine. I hope you check it out. There's a QR code on the screen as well as a link. And Jack has an incredible book on collective trauma. And if you are a trauma treatment provider, a psychotherapist who works with trauma, understanding moral injury is just critical. So why I'm so grateful to Jack for writing this article. It was a long time coming, and why I'm so glad you came here today. Ellen asked, does moral injury occur when children observe a parent or sibling being abused, and maybe they're standing by and they feel like they can't do anything?
I think that is a moral injury, or causes moral distress. The guilt of not being able to do something is different from a fear. Well, there may be a fear that one's parent is going to be hurt.
Yeah.
So you have a combination of kind of traumatic stress with a moral dimension. But I do think that the feelings that one may have failed to act, failing to prevent harm, leads to moral injury. That's another aspect.
Yeah.
So they may carry that guilt, and it never be addressed. There was this great example I heard from, I think it was Michael White or David Epstein, because I really like the narrative therapist and the way they approach some of this, because they have not been so narrowly focused as much of the trauma field has been on trauma.
Yeah.
And so I think some of the moral dimension often comes out in the narrative work that they do. So there was a guy who carried for years and maybe decades this guilt about witnessing his mother being beaten by his stepfather, and had, just felt tremendously guilty that he didn't do something to prevent this. Now, he was a child at the time, and he not only couldn't do something, but he ran away to the neighbor's house. But as the narrative therapist worked with him to really tell the story in detail, what had happened, the neighbor then called the police, who came, and the police stopped the stepfather from abusing the mother. So his actions actually led to the mother being helped in that situation. But because he had just focused on that particular experience of being there witnessing and trying to deal with the traumatic aspect of that, and not looking at the larger story, and he didn't have the larger story, which showed his agency and is actually having done something to that did help.
That's a great example. I thank you for sharing that. And I hope therapists watching are thinking about clients they may be working with who are trauma survivors, and or have experienced some kind of moral distress. And I hope that you'll take a look at that, and if it's relevant, to make that a part of treatment. I think you're absolutely right. We've narrowly focused in on trauma and PTSD to the exclusion of this moral dimension. And I hope your work and the work of Psychotherapy Networker will shine a little more light on moral distress and moral injury. And I think we've done a little bit of that today. I want to thank everyone for jumping in this short little interview. We do these Networker Lives once or twice a month. So if you're following us on social, you'll see them. The recording will be here in perpetuity for you if you want to come back. And please check out Psychotherapy Networker magazine, become a subscriber. You can read Jack's article on our website if you'd like. And please check out his moralinjuriesofwar.org. It's a great place to actually experience what moral injury is versus just talk about it or define it. And thank you so much, Jack, for being here.
One more thing. My email is on I think in the article as well. And I see that there are a lot of wonderful questions people are answering in the chat, or asking in the chat. So, send those to me. I think they're fantastic questions.
Yeah, I think it is in the, let me look. Your email is in the article. So if you do go to that article, you want to reach out to Jack for any reason, this is such an important topic. So thank you for bringing it again to us. And we hope to hear from you all again. Thanks everyone for being here. Thank you, Jack.
Thank you.